what is a protocol for somebody with type 1 diabetes starting on LDN?
Yeah, I think anytime you're starting on any medication, our motto is always start low and go slow. There are just, with compounding, that's the beauty of it. We can compound the low dose naltrexone into any strength. So we can start at very, very low dosages for patients to see how they respond to that medication. And then titration up can be on whatever the patient's needed timeline is. There's no set protocol that you have to increase your dose of low dose naltrexone every week or every 2 weeks. I've seen patients spread their titration out over a month or over 2 months, depending on how sensitive they end up being to medications. I think for someone like that, if they're interested in trying it, starting out at an extremely low dose would be a great option, and just doing a very, very slow and gradual titration up. Obviously, making sure that their provider is on board and aware of what they're doing, and, those blood sugar levels are being monitored consistently. But yeah, no, overall, I think that would be a good approach.
And the other part of that question was, over time, would she be able to reduce the amount of insulin she takes?
There's always the potential, and the inner patient variability, everyone's different. And so with one person, they might find that they are able to lower their doses of insulin, and another may not be. But that doesn't necessarily mean that the naltrexone isn't working, just because they are unable to lower their insulin dose. We know, again, as Shalin and Andrea have pointed out, with the decrease in inflammation that's happening within the body. I mean, that in itself overall is just having a huge impact, a huge beneficial impact on all of the different organ systems within the body. So I've talked to patients over the years that have Hashimoto's that have been able to lower their dose of thyroid medication because of low dose naltrexone. I've had patients who not even have to start thyroid medication for Hashimoto's because they were using low dose naltrexone. So, everyone's different, but I like I tell most patients, I think low dose naltrexone is always worth a shot.
Yeah, and I think going back to the patient that you were talking about with type 1 diabetes, obviously that's much different than type 2 diabetes. So type 2 diabetics, they may maintain a lot of internal inflammation, and that might be causing a lot of issues with the insulin resistance. It's not always the case with those type 1 diabetic patients. So as she's, titrating up very slowly, she continue to monitor those, the blood sugar levels and insulin and whatnot. I think it would be, at least from my opinion, it would be less likely that the insulin would be decreased in that type 1 diabetic patient versus a type 2 diabetic patient, which they may see an incredible amount of success in being able to lower insulin, the amount of insulin they're using, because of, as we were saying, that decrease in inflammation, as well as insulin resistance.
And they're just two different types of sort of pathologies, and LDN was probably going to be benefiting both through different mechanisms. Insulin resistance is just at the apex of so many different pathologies. And usually insulin resistance and inflammation, they go hand in hand. We discuss them separately, but they usually take place together, because once you have insulin resistance, it's hitting this enzyme called sirtuin-1 or SIRT1, and that gets repressed. And then you have inflammatory pathway called NF-kappa B, and that will produce cytokines that will produce insulin resistance and worsen it. And so it's a vicious loop. You have that at the forefront of all of these different pathologies. And, it's very interesting that LDN can hit it at that sort of like target. In the case of type 1, there is some autoimmune disease going on, but you may not have any more viable pancreatic beta cells. So hard to say how LDN would help with that. If there are, if it's an earlier stage, there's a potential that LDN can be quite beneficial.